So for Kristen, she came in complaining of crooked appearance of her nose, a small bump, and she wanted her tip a little smaller.
I decided to have a rhinoplasty procedure because it's actually something I've been thinking about since I've been about 12. I'm 29, so I've put a lot of thought into it, and I don't know, it's just the one thing about me that I always kind of wanted to change.
Due to her breaking her nose when she was younger, that's what caused the crooked appearance, and it was also causing her some breathing problems. So she came in, we discussed what her goals were. She wanted to straighten her nose and take care of the small bump while we were there, and also make the tip a little bit more defined. So it seemed very realistic.
I just expect to, like, hopefully I'll be able to sleep better and be a little bit more open, and hopefully not have to always give my good angle. When I get a picture taken, I can be photographed from all angles and feel beautiful. So yeah, just expect it to look like me, but a better version of me. Leading up to the procedure now, I've gone through every emotion possible. Yeah, I'm nervous, I'm excited, anxious, and I think ultimately it's going to be the right decision.
So what we did is we went in and we took care of those things for her through breaking the bones and shifting them in a more aligned position, and also doing a little work on the septum. What I did was just carefully take off the hump and take off really a minimal amount of cartilage so that the nose structure wouldn't be disturbed, and that during the healing process she would heal with a very natural appearance.
Walking through from start to finish, everyone very professional, very accommodating. I had my surgery like 2 weeks after my consultation. He had a cancellation, so I had it done in the middle of December. You know, by New Year's, it was like the cast came off, and you know, everything looked great. The
cast will come off after a week, stitches will come out after a week, and sometimes I'll recast the patient depending on the amount of swelling that's apparent. But usually after a week, most of the bruising's gone, the cast doesn't need to be replaced, so patients can go back to work. My surgery's only about 7 weeks old, so Dr. Kim has been pretty adamant about telling me 6 months to a year you get your final results. So I'm a little bit swollen in here, in the tip, so this will go down. So I'm sure if we did, you know, footage 3 or 4 months from now, it would be exactly what my nose is going to look like. So my major things were straighten out my nose and get rid of the bump. Upon straightening the nose, she's now able to breathe better, in addition to having a better cosmetic appearance. And she mentioned that one of the things she wanted was to have a very natural appearance to her nose. She didn't want a nose that looked like a nose job. I was the most afraid of looking like a different person. And I told Dr. Kim I wanted to look the same. I just wanted to be straighter, have a little bit more of a lift, and that's exactly what he did. So, minor. You know, it's more like, oh, Kristen, you look really great. Like, did you change your hair? Like, do you have a tan? You know, did you get a tan? It's like not, oh, I'm not the girl that got the nose job. So that's super cool.